Hello, and welcome to a short video tutorial on how to choose a health plan, with illustrated help from Ben. So your employer is offering you more than one health plan. How do you choose? Maybe you lean towards the least expensive option, or maybe you gravitate towards the plan with the lowest deductible, or maybe you pick a plan based on the advice of a coworker. There are a number of factors to consider when choosing a health plan. Let's take a look at the thought process for making the best decision for you. Before we dive in, let's take a moment to review preventative care. In compliance with the most recent healthcare legislation, preventative care is now covered 100% by all health plans at no cost to the insured. This means annual wellness checkups to your doctor are covered in full by any plan you choose. As with most of your daily decisions, the biggest factor when choosing a health plan is going to be money. It's important to realize, however, that cost is not just the premiums deducted from your paychecks. It also includes the money at risk to healthcare expenses each year under your health plan through your deductible, coinsurance, and copays. We will refer to this as your total exposure. Let's take a quick look at the various components of total exposure. The first component of total exposure is your premiums. What is each plan going to cost you? Your premiums are a fixed cost, meaning you will pay the premiums no matter how much you use or don't use your health insurance. For the purpose of comparison, you should look at this cost as an annual figure, not just a per paycheck figure. The second component to add in is your deductible. So for each plan option, what amount of money will you pay out of pocket before the insurance begins to pay for claims? This is a variable cost, as you may or may not actually incur any claims in a given year. The third component to add in is your coinsurance liability. With most insurance plans, once you meet your deductible, you enter into a coinsurance arrangement with your insurance company where they pay a percentage of claims and you pay the rest. Just like your deductible, coinsurance is a variable cost, as you may or may not actually incur any claims in a given year. The final component to consider is the copay arrangement for doctor visits, specialists, emergency treatment, hospitals, etc. Beginning in 2014, your deductible, coinsurance, and copays all add up towards your plan's stated out-of-pocket maximum. Now that you know the individual components of total exposure, put them together to make the best decision for you. This chart illustrates the key components of each health plan option available to Ben here at Benefit Educator, including the annual premium for employee-only coverage, the annual deductible, the out-of-pocket maximum, and the copay arrangement for each plan. We've also categorized each component as a fixed or variable expense. A good way to evaluate each plan option is to come up with a best case and worst case scenario. The best case would be that you pay your premiums and then don't use the insurance. In this case, you'd have only paid the fixed costs in our calculation. The worst case would be if you experienced a significant amount of claims which caused you to meet your out-of-pocket maximum under each plan. In this case, you'd then have paid both the fixed and variable costs in our calculation. Looking at the results, under the best case scenario, the least expensive plan option would appear to be the logical choice, while under the worst case scenario, the plan with the least amount of total exposure would appear to be the logical choice. No one knows your medical history and needs better than you, so it's ultimately up to you to decide if you want to plan for the best case or worst case scenario. In addition to total exposure, you must also consider your ability and willingness to pay for the increased portion of claims you could be responsible for under a higher deductible health plan. For example, choosing a plan with a higher deductible may save you money on your premiums, but it will also result in your portion of a hospital bill likely costing you more up front than it would have under a lower deductible plan. Understanding and utilizing these thought processes should lead you to make a better and more informed decision on which health plan is best for you. There you go. Now you know. See ya.